So what is safe window? So a safe window means this mode also have some disadvantages. Okay. For example, the patient's tidal volume can go very high, the respiratory rate can go very low, respiratory rate can go very high. Okay. So to avoid that, there will be some of the things we will set on the ventilator. Okay. To avoid the very high tidal volume, we will set a pressure limit set by the user. We already discussed in the previous slide what are the things we will set on the ASV, PEEP and FiO2 and Genter and height, and the one more thing is a P max. It's a pressure limit we will set on the ventilator. What does it mean? That it prevent the delivering of higher tidal volume. If example, I want to deliver my optimal tidal volume is 500 ml. Okay. Patient is achieving that tidal volume by a pressure support of 15. If lung compliance worsen, the same 15 centimeter now delivering only 300 ml. What actually my ventilator will do? It increase the pressure support to something around 20 or 25 to reach the same, to increase the tidal volume of 500 ml. Okay. If I set that, sometimes maybe the 25 maybe it will harm the patient. Okay. To prevent that, you have to set some pressure limit. If I set the pressure limit of 20, then ventilator cannot deliver the irrespective of my tidal volume, the ventilator cannot deliver the pressures more than 20. It's called P limit set by the user. Okay. One is the minimal tidal volume. Okay. So what does that mean? If example, I set a tidal volume of mid ventilation of 6 liter, I already told the ventilator can deliver the breath 1000 ml for 6 breath or 200 ml of tidal volume for the 30 breath. Okay. So to prevent that very lowest tidal volume, the ventilator will have some, we will set something as a protective example. If example, the ventilator can decrease the tidal volume value maximum 4.4 ml per kg. If example, it is a 2 times of your dead space. The dead space value we already discussed is a 2.2, 2 times of this dead space. So volume is what is around, it's around 2.2 is around 143. 2.2 in 60 kg means around 143 int 2. It's around 280 ml will be a lowest tidal volume. So there is some protective mechanism to avoid the highest tidal volume by setting a pre-limit. The lowest tidal volume, the ventilator won't deliver a tidal volume lesser than the 2 times our dead space or 4.4 ml per kg. These are the two productive safety limits. Okay. What are the other safety limits? The ventilator can decrease the respiratory rate maximum 5. If you don't decrease the respiratory rate less than 5. Okay. What are the other protective mechanism is maximum respiratory rate. Okay. If example, my tidal volume I can decrease the tidal volume. If example, my mid ventilation is 6 liter. I decrease my tidal volume maximum by 300 ml, which example. If the example means I can increase the respiratory rate is maximum 20. So it also one of the protective mechanism. So I can limit my maximum respiratory rate, minimum respiratory rate, maximum tidal volume by the P limit and minimum tidal volume by 2 limits of dead space. These are the safety limits of the ASV. There is called safety window. The ventilator can this called safety window. This with the ventilator can move the optimal tidal volume and optimal respiratory rate within this window. Okay. So that from this safety window itself we can identify what is the current status of the lung. Okay. If example, if it is a obstructive airway disease, if it is a COPD. Okay. What is the problem with COPD? It is auto PEEP. Auto PEEP will occur only if I decrease my expiry time. How can I decrease expiry time? If I increase the respiratory rate, automatically my expiry time will decrease, the auto PEEP can increase. So to avoid that, if it is obstructive lung disease, the ventilator won't allow the high respiratory rate. See here, the respiratory rate, the safety window is respiratory rate is very narrow here. Okay, for example, it is at 10 from 20. The ventilator will increase the rate up to 10 to 20 only. So it gives the safety window on the screen itself will give idea about what is the lung mechanics. Okay, if it is the narrow respiratory rate window, which means that it is an obstructive airway disease. If it is other hand, if you see here in the ARDS patient, there is a restrictive. Here aim is to avoid the very high tidal volume. See here, it is the tidal volume window is very narrow, but the respiratory rate window is very wide. Okay. For example, respiratory rate is 10, here it can go up to 40. Okay. But here the tidal volume is, example, it is at 200, it can go maximum 300 only. So, based on that, you can identify what is the lung status.